Stapler Hemorrhoidectomy by Dr. Vijay Dagar, proctologist and general surgeon. An 80 years old male patient presented with grade 4 hemorrhoids throughout the circumference of the anal canal without any significant past or family history or associated systemic illness was planned for stapler hemorrhoidectomy. The patient is positioned in the lithotomy position, anesthesia is administered, and the anal area is cleaned and draped. Step 1. Anal dilatation. The anal dilator is inserted to facilitate visualization and access to the hemorrhoidal tissue. Step 2. Apply purse string suture. Now the purse string suture is placed and it is a very critical step in the context of stapler hemorrhoidectomy. A suture is placed circumferentially around the hemorrhoidal tissue, about 2 to 4 cm above the dentate line. The suture is tightened to gather the tissue, creating a purse string effect. Number one purpose of this suture is to draw hemorrhoidal tissue into the stapler. Second, to ensure proper positioning of the tissue for stapling. And lastly, to prevent prolapse of the mucosa. Step 3. PPH stapler insertion. The PPH stapler is inserted through the anal dilator and the hemorrhoidal tissue is pulled into the stapler. Step 4. Firing the stapler. The stapler is fired, excising the hemorrhoidal tissue and stapling the mucosa.
ये ग्रीन पे है तो हम फायर कर सकते हैं. पॉज कर लो थोड़ा दूर से करके फायर. फायर जब होता है तो ऐसी आवाज़ आती है. और आपको देखना है आपका धागा नहीं कटा है, इसका मतलब आपने अच्छे से प्रोसेसिंग सूचर लिए हैं.
This is the donor of the excised hemorrhoidal tissue. Step 5. Inspection and hemostasis. The staple line is inspected for bleeding and if required, necessary hemostatic measures are taken. For more details, contact on this number. Thanks for watching.